about. And as we are discovering in our work in the Joy and Meaning Roundtable, this is a major reason for the lack of joy and meaning work. As Diane said, I've said this before, you would think that healthcare would be the most joyous work in the world because every day you come to work knowing you're going to do something that makes a difference, that you really help people. Very few people in their daily work can have anything to show for it when they go home other than they earn the pay. In healthcare, you make a difference in people's lives. People ought to be happy about that. If they're not, there's something wrong with the environment. But of course, the other thing is it's a threat to patient safety, which is how I came interested in this whole subject. Let me just quickly paint that picture. In the acute situation where you're really chewed out, humiliated by somebody, you have a lot of distress, fear and anger, and become emotionally upset to the point that your judgment is clouded. And you are then, at that moment, you are more likely to make a mistake. That is, if you've just been raked over the coals and then you have to go make a decision to do something, there's a higher chance you'll make a mistake in the acute situation. But long term, if you're normal, you adjust to that by avoiding that person if at all possible. And so when the doctor treats a nurse like that, then the nurse calls him only when absolutely necessary, communicates only what has to communicate, and doesn't share concerns and worry. Obviously, this is a threat to the patient because information is blocked. Passive disrespect, as I say, may be even more harmful because not participating in quality improvement and safety and following safe practices. Institutional disrespect clearly harms us. I've already mentioned that if you have to work and you're sleep deprived or you're overworked, you're more likely to make mistakes that hurt people. So all that's pretty straightforward. I think we also have some pretty good evidence that unhappy workers, just in general, are more likely to make mistakes. And so there's really a pretty good case from the safety standpoint that we need to do something about it. I have the following hypothesis, and that is that disrespectful behavior is the root cause of the dysfunctional culture of medicine. We have a dysfunctional culture. Dysfunctional in that people do not relate well to each other, we do not function well in teams, we can't deliver the quality of care we want to, and so we really need to change that. And my hypothesis is that the root cause of that is disrespect, and that this is our failure to make progress in patient safety. It's the reason many of our patients don't have a satisfactory experience, and it's one of the reasons why so many workers are unhappy. Why are we this way? I think it's pretty obvious why we're this way. We teach it, we tolerate it, and we cause it. We teach it. You learn disrespectful care treatment, mostly in the third year of medical school. There have been lots of studies. Students change dramatically from June one year to the next in the third year of medical school. When they go into the clinical years, when they're in close contact with the clinical faculty, they learn that I won't say they do, learn that it's okay to treat people that way. They see that disrespectful treatment is tolerated from people who have power and position, and they see it used as a mechanism for managing others. And so people are learning this. You're learning it in third year medical school, and it seems to be an almost universal experience. It seems to be all medical schools, and it seems to be almost all students who at least see it. Some people react against it and stand up and become their own person. Other people succumb and become part of it. But the vast majority of medical students in America today become very cynical by the end of their third year. They become cynical because they see the faculty teaching them and grading them on professionalism, but not showing it themselves. And that makes them cynical and unhappy. And the best proof I have of that is the contrary experience, which is the Cambridge Health Alliance integrated clerkship, which was started now, I think 8 or 9 years ago, with a subgroup of students from Harvard Medical School, a dozen students, who come for a year and have a mentor mentor in each of the major disciplines for the whole year. They have what's called a longitudinal experience, and the students follow the patients for the whole year, and they have an environment where the emphasis is on their learning and on patient respect and care of the patient. And at the end of that year, they have more respect for patients and less, and they are not cynical, and it really makes a huge difference. I think a lot of other schools are beginning to do this, but I think it's quite clear that it's in our ballpark to do something about it. The other reason, of course, is we tolerate it. If you're rich enough and powerful enough, bringing enough money, and you're the chief of cardiac surgery, neurosurgery, or filling the lines, you're allowed to get away with it. As long as it's tolerated, it will happen. It's also tolerated, of course, at a much lower level by all of us all the time. And finally, we cause it. What do I mean by this? We cause it in the sense that we have created an environment that puts the stress on people that makes it more likely they're going to behave this way. By our hours and our workloads and so forth, we make it more likely that people will be treated others disrespectfully, but also by creating just out of block. I'll come back to it. Anyway, I just came to it. The other thing is a thing we call production pressure. It's a term from human factors, and it's universal in all industries. The conflict in manufacturing is between getting the product out and having a safe environment for producing it. This is the same thing. We have put our nurses and our doctors under pressure. Doctors have to see a patient every 15 minutes. Nurse has to take care of 8 patients instead of 4 or whatever it is. And that production pressure puts a stress on people. So there's not much question that although we do provide bad role models and we do tolerate bad behavior, we also have an environment which puts stress on people and makes it more likely that they're going to act this way from time to time. So we have a big agenda. We have to deal with it, clearly. We recommend it and certainly believe we have to have zero tolerance for really disruptive behavior. There are places that begin to do this. Anybody here from Maimonides Hospital by any chance? Maimonides has what they call a code of mutual respect. They have a big effort to teach that, enforce it. The big thing here is really quite simple, and that is if you have a code of conduct, you have to enforce it, and you have to enforce it for everybody. There can be no exceptions, regardless of whether you're the head of cardiac surgery or you're a force. We all have to show respect, and there has to be a procedure for doing that, and that's important to make it fair. We also have to have methods for identifying problems before they're that bad, and one of the best ways for doing that is the so-called 360 evaluation, where every person gets evaluated by the people they work with, and then the department chairman or other leader, nurse manager, or whoever can then identify people who have problems before they get too serious. It's all about the golden rule. It's really quite as simple as that. We have to do what we can to prevent disrespectful behavior by training people. There's been a lot of work in this. Tim may refer to the work that's going on now in training for disclosure and difficult conversations. Same kind of thing for conflict resolution. Virginia Mason Medical Center system, one of the safest and most successful healthcare systems that I know of, has put in a Respect for People program in which they have run all the employees in the organization through learning about respectful behavior. Here's from their curriculum, for example, or their top 10 ways to show respect. So an overt effort to make a difference hopefully will make a difference. We, of course, have to address the underlying causes, reform medical education we're going to talk about, pay attention to these issues in our workplace, and we got a big agenda.